Good afternoon, everybody. I'm Matt Harrington with the Southwestern Vermont Chamber of Commerce. Thank you for joining us. Sorry for the delay. For those of you that have been hanging around trying to watch the Facebook Live, thank you for hanging around. And I know we've got a great panel and guest lineup here today. So your wait has been worth it. We're here with the team from Southwestern Vermont Medical Center. First, I have to thank Cat TV. They're all over the place, making sure that we can broadcast from the Chamber of Commerce, making sure we can broadcast from Southwestern Vermont Medical Center, and even in the corner down there, Patty at Cat TV Studios. So thank you so much for Cat TV and their partnership, their continued partnership, as we update the community about COVID-19 and the recently released vaccine. If you are watching this on Facebook, it will be recorded as well. You can also tune into Cat TV channel 1075. But if you are watching on Facebook and you do have questions for our panel, please just write in the comments. We have a couple people following along. I'll follow along as well and try and get to your questions. We do have a lot of questions for the panel already. So if you listen carefully, you may hear an answer to your question before you have to write it. So give us some time to go through these initial questions. But if something's been, you've heard it in the national news and you want to know how that impacts locally, this is the team to ask here today. And with that, I want to welcome back to the telecast, who we've had on, I think, since March, Dr. Trey Dobson, who's the Chief Medical Officer and Board-Certified Emergency Physician with Southwestern Vermont Medical Center. Last week, we saw from Dr. Marie George, who's the disease specialist at Southwestern Vermont Medical Center. And new to the panel, joining us today, Dr. Anne Marie Swan, board-certified hospital medicine and a physician that floats between the emergency department and inpatient units. And finally joining us, Patricia or Patty Johnson, who's a registered nurse in the emergency department. You know, one important thing we have to mention about this panel that we wanted to get them on and talking to the community is they have all received the COVID-19 vaccine. And so that's something we're going to keep a focus on today and talk with a lot of the people on this call. So let's get right into it. This question I want to talk to Dr. Swan and Patty about. You know, you were the first two that volunteered to receive this vaccine. How does that feel for you to be the first in Southwestern Vermont medical history to receive this vaccine? Why don't we start with you, Dr. Swan, and then we'll go to Patty.
Well, it was really a tremendous privilege to represent my colleagues actually as the first person. I think everyone wanted it, but to be that person to represent everybody, not only my physician colleagues, nurses, the staff, the people behind the scenes, it was really an exciting day for so many of us to do it. No fear, really just excitement.
Terrific. And I remember talking with Dr. George last week about that excitement. Patty, how about you? How did that feel to be one of the first? Oh, you're muted, Patty.
Hello. Thank you for having me today.
Absolutely.
I'm so grateful and I'm honored to have the opportunity to be the first nurse at SVMC to receive the Pfizer vaccine. I trust in science, and I want to lead by example. I know that there's a lot of fears and hesitancy among some of our BIPOC population and marginalized people in the community, and I just want to let them know that this is something that can help. Help is on the way from SVMC and the government, and we are here to break down some barriers, and I'm just honored and pleased to be a part of that. And, you know, there's a lot of obstacles historically in healthcare, and we're here to just let them know that we're not going to let that get in our way, and we're ready for the vaccine.
Great. And we're honored to have both of you on here. So talk to us a little bit more in depth. I mean, how big was the shot? How did it feel? I mean, nobody likes shots. How big are we talking about here? And so what was the actual process? We've seen those photos emerge on Facebook and in pictures and even in some video. But talk to us about the process as you went in and then kind of the what does it look like? How do we prepare our audience for their experience?
Well, I don't know what the registration will be like for other people or patients, but simple, you know, ask your name, date of birth, that sort of thing to make sure you're the right person. But once you're in the seat, I didn't even feel it, honestly. I think that it's a really fine needle. I honestly didn't even feel it. My kids were surprised, I think. It wasn't sore, it was really simple, almost like a non-event, yet symbolic in other ways. So I didn't feel it at all. I don't know about the rest of you.
I also did not feel the injection, and I have to tell a little secret. I am afraid of needles and I'm afraid of blood work. You might think that's a little odd coming from an emergency department nurse. I have no problem obtaining blood or starting IVs on other people, but personally, I have a fear of needles, and it was great. I didn't even feel it. I was pep talking myself. I said, you got to get it together, girl, because you got to represent. So,
well, and it sounds very much, and Dr. Dobson and George step in here, like the flu shot. I mean, something that we kind of think about, most of us get every year. Is that something similar, something we should expect?
I guess I can jump in. It seemed easier to me than the flu shot. I had a tiny bit of soreness on my arm after 24 hours, but that was literally it. And I hope the second one will be similar. The process of getting it, when we do a process for the general public, we're working on that right now. And it's, we plan it to be as easy as people receive flu shots this year, where they drove up in their cars and provided, information already done online or on a clipboard, and then they got their vaccine. It may not be exactly in a car. We haven't completely done all of that, but the process was really very streamlined. Easy.
Great. Remind us again, especially Dr. Swan and Patty, what day did you get it? So what day are we on now that you've been with the vaccine?
It was Wednesday, so it's been almost a week. And as I said, I had no side effects, a tiny bit of soreness that night, but that was it. Nothing. I kept thinking something, but didn't get any headache or fever or anything. And then my next shot is due, I think, January 6th, so 3 weeks.
And you were talking about that, Dr. Swan, before we went live. So you just got an email that said very much you're ready.
Your appointment is 8 a.m. on January 6th for the second shot.
Great.
Yeah. So
and we have found that even the COVID testing has been very well run, especially by the state of Vermont, where you're pre-registered and you get email notifications. Patty, kind of a couple days after, almost a week after, anything that you're feeling, you said wasn't even any soreness, which means you're just braver than all of us when it comes to needles.
I wouldn't go that far, but I did experience a little bit of soreness for the first day. Had a few things like a sneeze that I felt, could that be the vaccine? And it's just a sneeze. You sneeze every day, Patty, calm down. So, it's more psychological, but the process was very streamlined, very professional. And I really enjoy the text messages that I get daily, reminding me to check in with my symptoms, and it leaves a space for me to add things if I need to, anything that they might not have asked. So that comes daily, and it's very easy. It was like a little QR app that you scan with your phone, and you get the reminder. Very simple.
That's terrific, and I think that's one of those silver linings we have found. Just the technology increase when it comes to medical and healthcare has been tremendous this year. Couldn't agree more. Dr. George, here's a question, kind of a follow-up from all of it seems like nobody's had any true effects from the shot, but how long does it take for the vaccine to take effect and start to provide that protection? Obviously, we've learned that you'll have to have a second shot. Dr. Swan has hers coming up. how long does the first vaccine take to start to work? And then talk to us a little bit about the booster too.
Well, we know that the Pfizer vaccine has done quite a bit of work on how fast it takes, how fast immunity begins. And it's sort of interesting that within around 7 days, you have a great profound immunity, 95% protection or however, and that wanes a little bit. That, goes down before your second vaccine. So, by your first week, you've got quite a bit of immunity, but there is this transition period where you're getting immunity and losing it, and it's not robust. And so we do know that people can acquire the infection even after their first vaccine. So that, all that work is not, solidified, and we're going to need large groups of people to know exactly, that all that data. But by the time you get your second vaccine and 2 weeks after that, there should be very robust amount of immunity. But again, we're not recommending that people stop masking or using all their mitigation until we get the, all good from having many, many people immunized.
Yeah, and that was one of my follow-up questions. So I appreciate you answering that. So even as we start to roll this out, and we talked last time, it's going to start to pick up pace in the new year as many, many people get vaccinated. It is still really important for people to follow Dr. Dobson's 5, right? And part of that's washing hands, keeping face masks, social distancing. We should all still be doing that well into the new year. Is that kind of what I'm hearing?
Yeah, absolutely.
Okay. If you're just tuning in, thank you for joining us. This is brought to you by the Southwestern Vermont Chamber of Commerce, Southwestern Vermont Medical Center, and our partners over at CAT TV. If you're watching on Facebook Live, you have questions for our panel. They're a great panel of various different professions within Southwestern Vermont Medical Center. So if you have a question, please put it in the comment bar. We have people monitoring that, including myself, and we will try to get to those questions as fast as we can. I want to stick with you, Dr. George, for a little bit. Now that we have 2 vaccines, is there any significant difference between them? And it sounds like you really have to get that first one, and that gives you 95%, and then the booster. But talk to us a little bit about the difference. Could you even screw up one of them?
Well, there's not a recommendation to get one from one manufacturer and then the next from the second manufacturer. And in fact, the processes of you getting your vaccination is very, very definitive about that you will only get one manufacturer. You get a card and you're actually registered to only get one kind of vaccine. So people should not feel like that will be mixed up, that there's great efforts to make sure that there isn't. Both of those vaccines were created with the same technology, which is I won't go into the technology, but they're very similarly made, but they do have some differences. The storage capability, the storage requirements of one is a colder temperature than the Moderna, which is slightly less cold, but we have everything for both of those. The time period for recommendation between the first and second vaccine is a little different, with the Pfizer vaccine 3 weeks between and the Moderna vaccine 4 weeks between. And I said last week that we were it's a good thing that there is some leeway with both of those, so that you're not losing out by having it a little off the schedule. Although our intent is that everybody will be right on schedule. I suppose one fairly big difference is that the Moderna vaccine has only been authorized to be used in people 18 and older, whereas the Pfizer has been cleared for 16 and older.
Okay. Is there any concern, or should people have any concern, that I got committed to the Pfizer vaccine and then Pfizer ran out? and so I can't get my booster. Is there even a possibility of that?
Right. Well, yes. I mean, that's why I started to say that, in fact, there's a process of your second vaccine is being held, and saved basically for you. So there will, if there are any difficulties with manufacturing, it will not come from the second vaccine um, supply. That will be prioritized. So as we understand it, those are already allotted, and once you get your first, you're getting your second.
Okay, that helps. We've got a question that I think is good right now to ask, coming from Facebook. When you receive the vaccine, can you still spread COVID?
Go ahead, Trey.
Say that one more time.
So certainly early in the vaccination process, that's obviously true because it takes a while to build up the immunity. Whether or not you can spread it afterwards is unknown. I can say we are hopeful that the ability to transmit the virus is less and hopefully much less once you get vaccinated, just like it is with many other diseases. But we certainly do not want to say anything definitively right now because this is going to take experience. Stuff in the lab is not going to help us with this question. And that's okay because we're going to continue with the mitigation and we're going to continue with these measures until we can get a sufficient amount of the population vaccinated. And I will tell you that once we do, that question becomes not moot, but it definitely becomes less important. I think it's really, really vital that the audience here understands what we're trying to do, and that is vaccinate a large percentage of the population. If we don't get a large percentage of the population vaccinated, it doesn't matter that it's 95% efficacious or 95% effective because your chances of getting the virus are still quite high if you're running into it all the time. But if it's not out there much, your chance is really low. So let's all get vaccinated so we can save a bunch of lives and get rid of these masks and inability to travel and interact with each other. That's what we want to do.
Yeah, and I think it's important to note, so says the chief medical officer of our regional hospital. So as people, I think, Patty, you were mentioning before, try to challenge some of the assumptions around this vaccine, if you're watching and you're a local Benningtonian or Manchester or Dorset or anything like that, our chief medical officer is instructing us, and I think there should be good faith in that. There has been news and recent news that some of the virus is mutating over in the UK. Should we be concerned about that, and will vaccines be effective against the strain? This question goes more to Dr. Dobson and Dr. George. What are your thoughts on that?
I'll start off, Marie, and you can add in some of the infectious disease science. First off, yes, we should be worried if there are strains that come out that are more easily transmissible, which is what it looks like this particular strain, at least through modeling, appears to be doing. It actually is even more reason why we need to get vaccinated. Now, you'll hear that it's probably not any more dangerous or probably not resistant to the vaccine. I can say that it would be really unlikely, incredibly unlikely for it to be resistant to the vaccine. But the notion that it's not more dangerous is false. It's definitely more dangerous if it can spread faster. If it can spread faster, it's going to spread to more people. And if it spreads to more people are going to die. So of course, it's something that we need to be concerned about, and we need to combat it in one way. And that is, actually multiple ways. That is to get vaccinated and continue our mitigation until we can get through the spring and get a good percentage, at least in this region. Let's focus on Vermont. Let's get 65 to 85% of us vaccinated, and we will be in a really good spot.
Yeah, Dr. George.
Not much to add to that, except that we expect that the vaccines will protect us against this strain, just as Trey has indicated. We do not know that this strain is any more severe, although mutations, are can affect all different, activities of microorganisms. So the fact that it is more easily spread is something sobering to us, and it does reinforce get vaccinated so that this more easily spread virus is thwarted. It's even more of a reason, as Trey has said. I'd reinforce that.
Great. The question coming into what can we do as a community to encourage people to get vaccinated? And so I want to ask the full panel this one. What can we all do to help you do your jobs?
Yeah, I'll just start, Matt, since I talk about this a lot. We all do. First off, it's to listen and understand. I mean, these concerns are real, and we applaud people thinking. We applaud people worrying about what they're doing to themselves. It's really important. We just have a different vantage point. We know that vaccines are safe and COVID kills. We know that vaccines are safe and COVID wrecks the economy. We know that vaccines are safe and COVID closes our schools. We can't have this continuing on. I will tell you, over 1 million healthcare workers have now been vaccinated. You know, we're a panel of early people. That was just a week ago. Over 1 million people have been vaccinated, and it's great. And we've got a long way to go. We get into the community. So what we can all do to help is listen to people, acknowledge their concerns, and help them see the science behind it. And if they're not ready today, let's help them be ready tomorrow, not months from now or years from now, because it's going to take that.
Great. Others? What are some other ideas?
Go ahead. I mean, I would echo a lot what Trey said. Really just listening to people. It's great that people are analytic and thoughtful about this and their health, but make sure you're looking at reliable sources. There's a lot of fascinating things out there that are meant to be to catch your eye. But really, if you're really being analytical, look at the reliable sources and the data and talk to us. You know, we're happy to talk with you. We're not trying to harm ourselves. We're trying to or harm you. We're trying to help you. We, as Trey knows, we see COVID. You don't want it. You want the vaccine.
Great. Dr. George or Patty?
I just want to say that, you know, sticking to the facts, remember to continue to social distance, wash your hands. COVID fatigue is real. I think people are ready for this to be over. But the only way that we can help speed that up or ensure that we overcome this together as a community and as a state is if we focus on basic hygiene and remembering that they're proven facts that work. And we've been doing a great job. That's why our rates have been so low. And I'd like to say thank you to everybody in the community who's been working so hard to ensure that they practice all of those social etiquette norms.
Yep. Great. Dr. George?
Well, I'd echo Patty too, because, you know, the conspiracy theories are tantalizing and are scary about, you know, what these vaccines, you know, are rumored to do, which there is no real scientific basis for some of these rumored things. It is so important to understand that the science has predicted truly what this pandemic has looked like right from the beginning, and that Vermont is a living, breathing way of knowing that when you follow the tenets of all the things for mitigation, you know, keep your levels of infection low. And it's so easy to see that when people are letting down some of their guard, you know, we're seeing outbreaks in families. You know, we don't yet have widespread community spread, but it is right here. It is the truth. There is, you know, I hear so many things, but we are the way to know that when you do the right stuff, you keep, you know, cases down. I mean, so many places in Europe and Taiwan, you know, they did the basics, and they're a living, breathing way of knowing that is the truth. So, you know, vaccines are just, you know, are caught up in that conspiracy stuff that it really isn't factual. So, you know, whatever we can do to really stress that and, you know, we're thankful for a platform to do it.
Absolutely. And Dr. George, without going away from you, I see that you have a sticker on your lapel. What does that sticker indicate?
That says I got my COVID vaccine. I
Great.
got
So-
mine 2 days after, and everybody will get a sticker.
There you go. As soon as people were putting away the vote sticker, we have now a COVID vaccine sticker. So one more reason to go get a vaccine. There is a question on Facebook. I know we'll probably get to it, and Dr. Dobson, maybe a good time to put up your timeline. There's a question around when does the general public get vaccinated and people without high risks. So if you just want to walk our audience through that. I know you did it last week, but I'm sure we have new people on. So walk us through what the next 6 months look like.
There we go. Sure. So I hope folks can see this vaccine timeline. You notice that right underneath the title, it says subject to revision. And that is true. There are no certainties in a pandemic, but we are working forward with this vaccine timeline that actually comes from a federal level, a state level, and a local level. So you see that in phase 1, which is where we are now, we began in mid-December, and that includes healthcare workers, EMS, and other frontline workers that are exposed, as well as those that can transmit the virus to multiple people. So that's the initial group. When we get down into the second parts of phase 1 in the purple, we start looking at adults with high-risk medical conditions and of a certain age. You'll notice I put 65 plus and then I put 75 plus because it's still being finalized right now. In fact, right before we started live here, Marie and I were just talking about how Dr. George and I were just talking about how they're making some more revisions. But it looks like in our area where we're so far having good supply, that we will begin to vaccinate the public in a matter of 6 weeks, starting with these high risk individuals. And then we will move, as you can follow in this timeline, to other parts of society, including those that are teachers, food service industry, and other critical functions, and then over to the general public. So I'm actually hopeful that if things continue to move forward as well as they are, especially in our area, that these arrows are exactly correct or maybe even conservative, such that by mid-spring we could be vaccinating many of the general public. Now, I say that there are many risks involved. There's risks of manufacturing delays. There's risks of distribution delays. There's risk of communication difficulties. But we do hope, as Dr. George said early on, to have an outdoor drive-through vaccination clinic, just like we did for influenza, that worked really well. And we should be able to start those again in the mid-spring. We will be doing sign up for this phase 1, the purple, online for certain groups. You can check our website. We update it regularly. There's no sign up right now because we're still getting through healthcare workers. And then by the time we get into the next phases and we're having this drive-through, eventually doctors' offices will start receiving the vaccine. So it's very probable that most of the community actually gets vaccinated at their doctor's office or a stand-up clinic near their doctor's office or at the hospital. Well, it should be several options at that point.
Great. Yeah, and just to reiterate, so be going over to the hospital's website. I'm sure knowing Ray and his ability to communicate, it'll be all over Facebook. We will promote it as the chamber. I'm sure Cat TV will as well. So you really should not, you shouldn't miss it if and when it is your turn to get that. Talk to us a little bit about, I know you're focused on healthcare workers as it pertains to kind of the greater Southwestern Vermont healthcare family system. What's your how long do you think that process takes? Obviously, Patty being one of the first nurses to get the vaccine, how much longer do you all have to go through about 1,000 or plus employees?
We actually have healthcare workers in our region, about 3,000, is the estimated number. And,
Okay.
and that's because what you might think of as traditional healthcare workers, for example, Patty and Dr. Swan, are frontline workers, but there are many people that work with patients out in the community, from private physician offices to dental offices to home health nursing to EMS. We're getting through all of those. They're being prioritized. For example, EMS is a high risk, so they're getting vaccinated beginning next week, we hope. But this whole process, if we get the vaccine supply that we expect, and so far we have been, you've read in the media about some difficulties, if that continues, we will be done vaccinating all of the healthcare workers in the area that come forward and wish to be vaccinated, which we hope is at least 80% within a matter of 3 to 4 weeks. The process is actually quite straightforward. It's just like we've done forever with the flu clinic. So I'm knocking on wood because there's always some unanticipated barriers that can occur, but there's nothing different here that makes this particular process more arduous, other than some cooling requirements that we've gotten taken care of.
Great. If you're tuning in from Facebook, I want to remind you that you do have the opportunity, if you do have questions, to ask that in the comment bar on Facebook, and we'll work to get to those questions. We have a couple that have come up that we've been able to answer, and that's the point of this, is just to continually communicate with the community. I know we've talked about it, and it's something I want to push home, because I really, without getting into too much of the politics of it, we really, one of the greatest disadvantages that we're at right now is that some people don't want to get the vaccine or are nervous about the vaccine. Again, just to remind our audience, kind of why get the vaccine? What if, I've heard of friends, they've gotten COVID and they're fine. And I have friends in Florida and they've gotten COVID and they're fine. This seems like a bigger deal than maybe it really is. Those are some of the things we hear out in the community. Just anybody on the panel, talk to us a little bit about, again, the just straight up importance of the vaccine and defeating this enemy.
Yeah, let me just start and then go around the room here. There's two main things. The first is I get the vaccine to protect my family. I get the vaccine to protect the babies. I get the vaccine to protect my friends. Yes, a lot of healthy people can get COVID and do pretty well with it. What you're not reading are the people that don't do so well with it. And then there are people that have long-term sequelae, so long-term effects from the illness. But so by getting the vaccine, we're protecting everyone. And again, just the analogy that if only a few of us get vaccinated, the virus itself will just continue to rage in the public. Whereas if we all get vaccinated, it just dies off. Now it'll be, in low levels, probably forever. But with a vaccinated population, your chances of coming across it is really low. With a highly effective vaccine, Matt, if I see COVID every day, I'm still going to get COVID. Because if it's 95% effective, I'm going to roll that dice every day. I'm going to come up with that number sometime. But if everyone is vaccinated, or a vast majority are vaccinated, the chances I run into COVID are a couple times a year. And if it's 95% effective, the chances I get it is extremely low. So that's a little bit for illustrative purposes, but it actually works itself out. And I'll stop there and let others talk.
Thanks.
I'm going to go next only because I want the two really front line people to really tell us what they see, in the hospital, in the emergency room, and what our patients are suffering with. I can just say that right now, in places that have more COVID, they are creating chronic COVID clinics because of the sheer number of people that have post-COVID problems that are, that are now growing in numbers of what those problems are, besides the clotting problems and the heart dysfunction problems and the loss of smell and taste. This is a disease that we are still learning about how the long-term problems, will be. And to have places that now need a clinic devoted to that means that this is not just something that's affecting the frail or the elderly.
I'll pop in. I think, like I said before, if you have the opportunity to protect yourself to not get COVID, that is absolutely what you want to do. We're seeing patients in the hospital, they're not all elderly and frail, and a lot of them don't have comorbidities or risk factors. They're, if you're talking about statistics, favorably, the young people do well, but there's also those that don't. And you don't want to be that statistic. And so if you can protect yourself against it, absolutely. To me, there's no question. And I think unless you've seen it or had someone in your family have it or witnessed it, you feel like, oh, it's no big deal, but it really is. I can't, pound it home anymore, how this can have long-term effects, and some people don't make it.
Yep. Patty, the final word on our audience in terms of why get the vaccine.
So I know we all grew up with the saying, sharing is caring, but sharing the flu or COVID is not caring in this case. And I love this community. I grew up in this community. I enjoy working in the emergency department to help strengthen this community. And it's a little disheartening to see some people who don't believe and who are not taking this seriously, who are walking around without a mask. And I want to tell you that this is real. We see it, and we're doing the best that we can to combat it. And I want to let you know that you might not know that you have symptoms. You can be asymptomatic. And it's one of my concerns that I've had going home. I live in a multi-generational family setting, and I was afraid that I would, possibly bring home the virus to my family. My parents are a little bit older, but we have plenty of PPE. And so there's, no excuse for myself or any in the community not to be prepared. And I just really encourage people to, love one another, care for one another, check on those who might have mental health complications due to us having to quarantine, and those who have had to self-isolate, check on neighbors, FaceTime, Zoom, all that. We need to reconnect together as a community, and just not forget about one another.
Great. Thank you, Patty. And thank you, everybody. And thank you, if we'll probably say it near the end too, but, as a community, our as you've seen since March, our heart goes out to many of you on the front lines, especially the doctors and the nurses. So, we'd be remiss if we didn't do this telecast, and thank you all from the bottom of our hearts. I do want to pivot a little bit to, there seems to be, Dr. George, you had talked about, Vermont does quite well because it practices. We have started to see a rise in cases. Is there any, obviously there's concern around that, but to what degree of concern, and again, how do we hunker down over the winter? And I'll feed that one up to Dr. Dobson and Dr. George.
Yeah, I'll just briefly say the numbers are quite disturbing for me, to see 17 more cases this week. I probably, Trail have all those numbers. It just has been a rise that is more than what we've been experiencing. This is a classic rise after a holiday where people get together and let down their guard and are, mixing households and all of the things that we know are high risk. It is a very short distance between outbreaks within a small group or a family and community spread, where it just becomes, uncontrollable. And everybody has seen, quotes from other places in the US and elsewhere that say it's everywhere now. And that is not where we want to be. And we can tamp it down again. We can do it. Vermonters are a special breed. Even Williamstown people too, Anne-Marie, but they they've been strong, and they've been able to to delay, those all important visits, and we're all sick of this together. I've said this every time. We are all tired, but a little longer. We have vaccine here. We can do it.
Great. I want to continue on that theme of the holidays are coming up. We're a couple of days away from Christmas. Some people are already celebrating, finishing up Hanukkah. We go right into the new year. What are you all doing for the holidays? And it's probably a loaded question at this point, but what's everybody doing for the holidays? We'll start with you, Dr. Dobbs, and then we'll go to Dr. George, Dr. Swan, and then Patty.
Yeah, to echo what Dr. George was saying, I'm staying with my immediate family. I'm not seeing extended family. I'm going to see them next year. I'm really happy about that. Hopefully I'll even see them before that, maybe late summer or early fall. And the reason is if we let this virus continue to grow, it will be ubiquitous, and that'll break down our infrastructure. All of these businesses and schools, when they start getting cases, they have to shut down, and we just can't have that in this community. By the way, one more thing on what Dr. George was saying. This increase in cases, it's interesting because they have plateaued for the last couple of weeks because of the activity that Vermont is doing. And so it shows that we're a small state, and when we do things, we can see it in the data. It's delayed a couple of weeks, but we can see it in the data. So as long as we keep with this, our numbers will stay at a more manageable level.
Yeah, same thing, just immediate family this year for us. And, we have a large family that we would love to be with, but it's going to be a Zoom family reunion on Christmas Day for us.
Great. Dr. Swan?
I'm working on Christmas. So
there you go.
Someone has to, right? But same thing, it's just in my immediate family. I'm one of 11 children, so normally we have a big Christmas celebration around Christmas, which is obviously not happening this year. So sticking close to home and work.
Patty.
Hi, I also come from a very large family, but this year we will be sticking to Christmas with our immediate family here in Bennington. And I am also going to be working in the emergency department on Christmas Day.
Yeah. Well, we so appreciate Dr. Swan and Patty working Christmas Day. We know that's kind of what has to be done, but also Dr. George and Dr. Dobbs and all the work that you guys have been doing. I know some of you have to run on to other meetings and solving other problems throughout the day. On behalf of CAT TV and the Chamber of Commerce, I personally want to say thank you for the year that you've all just had. Thank you for continuing to keep the lines of communication open. And here's to a better 2021. I know that was one of the questions that we had framed. So we'll do a lightning round here. What does 2021 with a vaccine look like for all of you? And this is a lightning round. Everybody gets 5 seconds, and we'll start with Patty this time, and we'll go in reverse order. Patty, Dr. Swan, Dr. George, and then finally with Dr. Dobson. 2021 with a vaccine, what does that look like for you, Patty?
Love, peace, and freedom. Vacation.
Perfect. Dr. Swan.
My kids all being back in school. And maybe going on a vacation.
Great. Dr. George. Oh, you're on mute. Yep.
For us, it's a family wedding this coming fall, and maybe even another wedding if things look good, and a vacation to Bryce Canyon that we canceled last year.
Dr. Dobson.
Oh, I'm just going to look forward to reading people's faces that I can't see right now except on Zoom calls.
Great. Well, it seems like the theme of 2021 will be vacation. So let's all find the hashtag for that one. I want to thank all of you for joining us today. Have a very, very Merry Christmas, Happy Holidays, Happy New Year. And again, on behalf of the Chamber of Commerce and CAT TV, thank you for joining us. And thank you, everybody, for tuning in. And may your holidays be merry and blessed as well. Thank you so much. Have a good day.
Thanks for having us.
Thank you.